please take a moment to review the following.
So the second vessel we're going to look at is the directing vessel, or the Ren Mai. Sometimes it's called the conception vessel. This is the Sea of Yin. This is part of that first ancestry. It's what we call primal yin, or pure yin, or primordial yin. It's as yin gets. This is absolute yinness. There is no more yinness than this, if you will, right? This is the sea of yinness. And so if we need to bring yin into a process, this is the deepest place that you can go. Sometimes this vessel is called the vessel of containment. If you think about the uterus containing a fetus, you can see that the vessel itself can create containment on a process, which is very important because when people get stressed out, they tend to get leaky energetically. They tend to be scattered. They tend to be not well contained emotionally or physically in a lot of ways. So this vessel can create that containment, sometimes called the vessel of closure, which allows you to come to a stop to begin again, right? This is how we make transitions. This is how we let go of something. This is how we create closure and move on. We come to a stop, which is the most yin you can get, and then we move again in a new direction with new thought, with new purpose. So it's very, very effective for closure. And also, as the Sea of Yin, is known as the vessel of bonding. And this bonding that we talk about is not just bonding to self, it's bonding of any type. And also can be used to treat people who overbond or bond inappropriately. So here the pathway, much, much, much simpler. You have the master point, lung 7. Then you have the Ren Mai points, which everyone is familiar with because they get lumped into, they get added on to the 12 primary channels when you study the 12 primary channels. So you have Ren 1 through Ren 24, straight up the midline. Then you also have an energetics that encircles the mouth, which leads you to do 26, then spreads out along the face up to and under the eyes. So stomach 4 through stomach 1. That branch is a branch that also happens in the Chong Mai and also happens in the Du Mai, but it's most powerful, that facial branch, in the Ren Mai than any of the other branches. Because this vessel is a bonding vessel, it's about how we connect, and we use our senses, our 5 senses, organized on the face, to connect with the world around us. So this is much more of a Ren Mai thing than anything else. The couple point, which you will see us use a lot here in the treatment of infertility, is kidney 6, which is the master point of the Yin chakra. From a TCM point of view, the Ren Mai nourishes blood and yin, deals with all fluid issues, fluid deficiency, fluid excess. So it can treat everything from yin deficiency to edema, to phlegm nodules, to damp accumulation, lumpy, bumpy things. They're all made of fluid, right? It will nourish the joints and create fluid or lubrication for the sensory orifices, for the anterior and posterior orifices of the lower jiao. So this is a vessel that can be used for vaginal secretions to increase or decrease vaginal secretions. Regulates qi in all 3 jiaos. This is why it's sometimes known as the directing vessel, because it directs qi flow in the upper, middle, and lower jiao. Supports digestion and treats asthma. So it does a lot of general things that are useful, not just in infertility. But from an infertility perspective, this is a very powerful vessel for treating hormonal imbalances, Once again, I bring you back to the master point, which is lung 7, and we talked earlier about how important the lung is in regulating hormones. So not only is the master point a lung point, but it's also a low point, which deals with the emotional component of hormonal imbalances. So the Ren Mai is a very good vessel for regulating hormones. Regulates the 7 and 8 year cycles of Jing, so it can help to deal with the phases of the menstrual cycle and also changes in the menstrual cycle over time. As we get closer to advanced maternal age, you'll see the Ren Mai playing a very important part in this. It's very good for irregular cycles, very good for ovulation issues. This vessel can be used to treat hyperthyroidism versus the Chiang Mai, which treats hypothyroidism.
And why is that? Could you explain the hyper?
Normally, when we're dealing with yin, we're dealing with cooling, right? So hyper is more hot, it's more up, it's more yang, right? We're trying to bring the yang down. In the Chiang Mai, we're bringing the energy up. So if you're low in energy, you're trying to raise it. So we can treat PCOS here. PCOS has often a very phlegmy kind of component to it, which is a fluid metabolism disorder. The Ren Mai is very good at this. And it has the hormonal imbalances attached to it. So the Ren Mai is a good choice. We can treat endometriosis here, diminished ovarian reserve. In men, we can boost the fluid content of ejaculate. Sometimes men will have a very scanty ejaculate, not enough fluid. You can use the Ren Mai to treat that. We can treat poor sperm morphology. We can also treat in men stress-induced infertility, and we can treat hydrocele or fluid accumulation in the testicular region. Questions about the Ren?